Good morning, everyone. Thanks for joining me. This is Dr. Mitra. I'm the founder and CEO of Capital Eye Medical Group, an ophthalmology practice in Northern California, where we help patients develop their best vision and live life fully and enjoy their hobbies for years to come. So every Monday morning at 8 a.m. Pacific time, I do a Facebook Live in order to address a question that comes up either with my colleagues or patients. And today's subject, thanks for joining me in my studio, is, what's the best way to have long lashes? So obviously, some of this information is based on is informational. All of it is informational. Some of it is based on my personal research and experience, thanks to the questions that have come up. So one of the best ways and least expensive way is that you're born with long lashes. Most of us may not be blessed with that, or our eyelashes are not long enough for us to be, quite happy with it. So that's a matter of luck and genetics. If you are lucky to be in that segment of the population, the only thing you have to do is to take care of your eyelid, doing an eyelid regimen to minimize blepharitis or inflammation of the lid, and make sure that you continue to have healthy hair follicles with, no overgrowth of bacteria or crusting good on the lashes, and good lid regimen. So I'm not part of that group. The other one are, the one that I see most commonly are people that get lash extensions. So this is the one that I see the most. Now, whether the lash extensions are, individually placed or however it's placed, and a lot of times they're made of synthetic material like nylon fibers or whatnot. What I see on my side as an ophthalmologist, the complications or issues that come up due to sensitivity to the glue. So the glue is placed on the lash line or individually placed, and the lashes are stuck in the proper area. They look great. You don't have to remove them, on a daily basis. As a matter of fact, you can't. And they have to, I believe, be replaced or redone every 2 to 3 weeks. So there is cost and time cost, and of course money expense that's associated with it. So some people do well with this. A lot of times patients develop an inflammation or an allergy to the glue, so they switch to the glue for sensitive skin, and I still see reactions to that. I essentially see these patients, and what I see on my end are blepharitis. So patients come in, red rim around the lids. They can have a tendency to have increased styes or chalazion on the eyelid, which can be painful, it can be uncomfortable, and of course it affects your tear film. And I've talked about, the tear film and the quality of the tear film and how to maximize it in some previous videos that are will be on my YouTube channel, but they've been posted previously. So that's an issue. I think the last time that I had lash extensions placed was more than 24 years ago at my wedding, and I remember seeing the little lashes come off as I was taking a shower for several weeks after. I just didn't know how to handle it. So the third category, most common category, are lash serums. These serums are have different components, so they're divided into different categories based on that, but essentially you place it on the eyelid margin, mainly the upper one, and they contain the ingredients that help your lashes grow. So one category has, so pay attention to the content, right, to the ingredient. One category has prostaglandin analogs. It's a ingredient that's also in some of the anti-glaucoma medication, and it definitely works because we've been seeing patients on the glaucoma medication where the lashes, if they're taking it on one side, the lashes on that side have grown quite a bit, and the other eye, if it was not receiving the medication, it was not. So it works pretty well. It does take 3 to 4 weeks for it to kick in. However, there is a possibility that it can cause changes in the iris pigment, and so if you're blue-eyed, I'm not sure that you would like that. And also it can change some pigmentation around the lid. Not everybody, but there is a possibility. Frankly, I would have definitely used this one because I have, dark colored eyes, although I sometimes joke that I have blue eyes anyway. And it's certainly readily available to me, but I developed a sensitivity to it. So I'm one of those people that I cannot tolerate it. So even if and when I develop glaucoma, that won't be my drop of choice. So then there are other ones, and one of the ones that I have tried personally, these do not contain the prostaglandin analogs. They do take 4 to 6 weeks for you to notice a difference. And the way you notice it is when you're, of course, on a daily basis, you can, take a look, but at about 4-week mark, you'll notice a difference. When you're putting on your mascara, you'll notice you need less to really make those lashes pop. And they are cost-wise, and also you need a lot of patience, but it doesn't cost as much as some of the other methods that are used for this. The one that I have tried is called Lash Boost, and I haven't tried the other ones. There are many other ones on the market. This is the only one I can personally say that it does work, and since I tend to be sensitive, I have not developed a reaction to this. I'm just lazy and I have a hard time doing this every single night. So that's what I would do. I would, it comes in, let me see if I have it here. I must have moved it. So it looks like it comes in a mascara type of tube, but when you take out the brush, it's almost like the liquid liner. So you just go from the inside to outside and let it dry. I tend to do it at night because even if it dries, it doesn't, I can take it off in the morning if I have put on so much that it's flaked. But I do not sell this. I do not have an affiliate link for any of the things that I mentioned today. And so I just want you to know that this is because so many people are asking about it. I decided that this is a worthwhile question to respond to. So I have definitely done this one. Now, the fourth category, which is actually seems to be one of the favorite categories, especially if you're going to a party or something like that, are the fake lashes that are based on a magnetic liner. So they attach not with a glue, but with a liner that has ferrous oxide in it, and very little. And the lashes themselves have very tiny, like a band of flexible magnets that attach to the lash liner. Now, I think I posted a picture earlier on, but in our physician group, but I will definitely post the pictures because I had bought these lashes probably about several months ago. And from this particular company, the company is called Opulence MD. And the person who owns this, the developer, is actually an ophthalmologist. And so I thought, okay, if I'm going to try anything, I'm going to try that. And I was quite impressed with the look of it, but also the ease of application because I am lazy. Did I say that? I don't want to put too much effort. And so it really is quite easy to apply. I'll post some pictures just so you can see it. The company also makes different types of these lashes. So some of them are quite sassy, I would say, or quite bold. And there's other ones that are more natural looking that you can use for everyday use. The nice thing about it as an ophthalmologist, I like the fact that you can remove it and you can, clear off the magnetic eyeliner just like you would normally clear off your makeup. So as far as possible side effects, it seems like the fact that you can still do your lid regimen, You can have different, styles or types of it that you use. And as long as you're doing the hygiene regimen for cleaning your lids and everything else, this seems to be one where I could see myself definitely using it more frequently. But again, no affiliate link, but Opulence MD, made by an ophthalmologist. Again, for a low maintenance gal like me, I really liked it. So I'm so glad that you guys joined me, whether you join me live or if you're watching this as replay, please put hashtag replay. I would love to know if you have other questions that you'd like me to respond to. That would be fantastic. And you can find me and find information on me and my practice in Northern California on www.mitramd.com, MITRAMD.com. Name of my practice is Capital I Medical Group, and I can't wait to hear from you. Thank you so much. See you next Monday at 8 a.m.